Now to the story that's taking hold of our community once again. Another surge of COVID-19 is exhausting hospital resources. Panhandle Health reports 111 people tested positive for COVID today, with 84 people being treated at Kootenai Health. Now, 216 people tested positive for COVID in Spokane, and 164 people are in Spokane County hospitals with COVID tonight. Now we're getting a better idea of why our hospitals are being overwhelmed. Elenee explains what's going on.
Local hospitals tell me they are nearing capacity, saying there's a vicious cycle taking place with more people testing positive for COVID and healthcare professionals mentally and emotionally exhausted.
It's really that catastrophe that just keeps getting worse.
We're in a fifth wave, and healthcare providers are feeling fatigue. They've been dealing with the pandemic for 18 months, now having to go through another surge of people needing help.
When you talk to nurses and physicians and advanced practice providers that are working in these floors where they care for COVID patients, being exposed to that stress and that constant presence of really on a weekly basis tragic deaths that were preventable, it wears on those folks.
Medical professionals are leaving the industry, and that, coupled with more patients, creates the storm we're in now.
You're at near capacity, and we're still seeing increasing incidents of COVID spread in our community.
Providence Dr. Dan Getz didn't give specific numbers on how many beds are available, but says there are 80 people in their hospitals who don't need to be in the hospital but aren't ready to go home. Right now, they just have nowhere to go.
What the Medical Reserve Corps is hoping to do is help staff some of those skilled nursing facilities and hopefully get some of those patients into a more appropriate level of care, which increases our ability to care for acutely ill patients in the hospital setting.
Concerns are growing as we approach another holiday and colder months and school starting in a couple of weeks. 2 kids younger than 12 are in the hospital right now with COVID.
And our concern is that the intersection between COVID, RSV, and influenza, which all share similar symptoms, really are a potential for a large amount of admissions this winter.
Dr. Bersotti went on to say that during the last few surges, pediatric doctors were able to help with other COVID patients, but if more kids get COVID or the flu and RSV, it's going to get difficult. Sacred Heart is working with 2 other children's hospitals in Washington to figure out how they're going to manage all of this. In studio tonight, Elenee, 4 News Now.